Okay, so today we're going to be diving into section two of the supervision workbook, where we will focus on preparing for the first supervision session. At least that is what the book covered. So we're going to explore essential tasks, best practices, and key considerations to ensure that both supervisors and trainees establish a solid foundation for successful supervision. So before we get into the specifics of what was covered in this chapter in terms of preparing for the first session, let's quickly review the key takeaways from section one because we did have a week in between. So we established during that time that supervision is not the same as therapy or consultation. It's a distinct practice designed to ensure the growth of trainees while maintaining ethical and professional standards. We also reviewed various models of supervision, including developmental, process-based, and psychotherapy-based models, which are often integrated. And we talked about the importance of the positive working alliance, and that was highlighted as a foundation for successful supervision, meaning the relationship should be collaborative, transparent, and focused on strengths. And finally, we introduced the role of things like positive psychology in supervision, which provides key concepts such as grit, flow, and character strengths that support effective supervision practices. Now, in section two of the workbook, we shift our focus from the theoretical foundations to practical preparation for the first supervision session. So, our three key goals for this first session are to establish that positive working alliance, which, as we discussed, is crucial because the quality of the supervisory relationship directly impacts the effectiveness of supervision. Number two, providing informed consent and finalizing the supervision contract, ensuring that both parties have clear expectations, understand their roles, and adhere to ethical guidelines. And number three, setting training goals, which involves identifying the trainee's strengths, preferred learning styles, and best hopes for supervision. So as we go through and we think about the book and we think about today, I mean, everything is designed to guide us in achieving these tasks as they work synergistically, right, to lay a foundation for supervision. So the first supervision session typically lasts between 1 to 2 hours, which means we need to maximize this time efficiently. Research has shown that trainees and supervisors value structured, organized, and intentional supervision. When these elements are absent, supervision can feel ineffective or even harmful. So, the preparation for a supervision session should mirror preparation for a client session. Just as clinicians gather information, adapt to clients' needs, and anticipate questions, supervisors and trainees must also prepare thoroughly. Self-reflection is a key part of preparation for both supervisors and trainees. Before stepping into the first session, consider your best hopes. So, what do you want to get out of supervision? Your attitudes and beliefs. So, how have your experiences shaped your expectations of supervision? Your strengths and learning style. So, are you a visual, auditory, or kinesthetic learner? We're going to talk about that in a moment. Your biases, values, and expectations. So, awareness of these factors helps ensure that supervision remains fair, objective, and effective. Supervision anxiety is common for both trainees and supervisors, and there are three types. Anticipatory anxiety, which stems from uncertainty about what will happen. Approval anxiety, which comes from wanting to impress or gain approval. Dominance anxiety, which relates to concerns about power differentials. So, to manage anxiety, remember that it's normal and can be addressed through strategies such as cognitive restructuring, behavioral exposure, and values based work. Research shows that emphasizing strengths improves motivation and learning, so supervisors and trainees should identify and integrate strengths into supervision. So, two tools that can help with this process are the VIA character strengths survey, which identifies personal strengths, and appreciative inquiry, which helps focus supervision on strengths rather than deficits. Um, Supervision is most effective when it aligns with the trainee's learning style. So the VARC model identifies four primary styles. Visual learners, who benefit from things like charts, diagrams, and visuals. Auditory learners prefer verbal discussions and lectures. Reading, writing learners process information best through written text. And kinesthetic learners learn best through active participation and hands-on experiences. So I just wanted to unpack this a little bit more. Visual learners grasp information when it's presented in things like charts or diagrams or videos. A useful strategy is using like a flow chart to illustrate supervision topics such as case conceptualization or ethical decision making. So for example, when discussing the stages of change model, a supervisor might provide a color-coded diagram showing pre-contemplation, contemplation, preparation action, and maintenance. Visual learners also benefit from seeing video demonstrations of counseling techniques before trying them themselves. Auditory learners benefit from spoken discussions and verbal processing. So supervisors in these cases should encourage case discussions, Q&A formats, and listening to relevant podcasts or recorded lectures. One great technique is verbal rehearsal. So having a trainee explain their approach to a case out loud before applying it in practice. So for example, if a trainee is unsure about how to approach a difficult conversation with the client, the supervisor might have them role play the dialogue first, helping them refine their wording before the actual session. Reading and writing learners process information best through text-based material, so they often thrive when assigned case study readings, journal reflections, or written self-assessments before supervision. So for example, a supervisor might provide a detailed ethical dilemma case study and ask the trainee to write a response analyzing potential ethical concerns before discussing it together. So these learners benefit from keeping a supervision journal where they reflect on their progress and challenges. Kinesthetic learners absorb information best through hands-on practice and real-world application. So supervisors should incorporate things like live demonstrations, role-playing, and interactive exercises into supervision sessions. So for example, a trainee learning crisis intervention skills might first role-play a de-escalation scenario with their supervisor before attempting it with an actual client. Encouraging real-world practice, such as shadowing experienced counselors or conducting mock therapy sessions, can be highly effective. So to wrap up here, here's a checklist for preparing for the first supervision session. Completing these steps ensures a strong start to the supervisory relationship and a productive first session. I'll give you a second to read them. And I think these are our key takeaways. Understanding learning styles is crucial because every trainee is unique, and most people are multimodal learners, meaning they prefer a mix of different learning styles. So supervisors should assess their trainees' learning preferences early on and adjust their approach accordingly. So likewise, trainees should communicate their preferred learning style to the supervisor if they know it, to ensure they are receiving the best support for their professional growth. All right, thank you.